Hello, I'm Becky Rose, and today I would like to talk to you about this big debate that has been going on, this whole healthcare thing in America, right? Because I haven't been paying much attention to the world lately. It just passes me by, and I'm okay with that. I don't need to pay attention to the world, it just happens. I haven't watched news since the invasion of Iraq, would you believe? Um, so no, I don't pay much attention, but I do get to hear about things, and I keep getting asked when I talk to people online about what my views are on the healthcare system on America, what my views is on social health and whatever the barbaric system the Americans have at the moment, what they're calling it, that Obama's trying to shake up. And the answer is very simple to that. The first thing um, that I've seen some American news reports that have been posted on various internet forums and stuff. I don't know how the news channels went. I think it's Fox News has said some things like Britain 37% of cancer patients survive, and in America it's 95% or something like that. And when you actually look at it, what's happening is that in Britain we don't test for non-fatal forms of cancer because they don't need treating. If it's not going to affect you, then it doesn't need treatment. Not every type of because cancer encompasses lots of diseases, and not every type of cancer causes a problem. Um, in America, these things are tested for because it's cancer. Therefore, it can have an operation and be charged for and earn money because the whole health industry is about generating revenue. Um, Hence, we have a 37% or some really low, I forget the actual number actually, but some really low percentage because we're only dealing with cancers that that are fatal or are life altering. Whereas in America, you could get a tumor somewhere that you will not affect your quality of life, and um, and isn't going to kill you, isn't going to spread. It's what they call a benign tumor, and they'll chuck you into an operating theatre with a 5% chance of death because they can charge for it. Um, so there's a lot of misinformation going around. So what I wanted to do was just speak some very simple, clear facts. And what I'm going to use to illustrate that point is the country with the best healthcare in the world, according to the World Health Care Organization, is France, that has a social healthcare system. Second is Italy, social healthcare system. Third is San Marino, social healthcare system. In fact, the entire top of the chart is populated by countries with a social healthcare system. My country, Great Britain, is currently 18th. America is doing quite well, actually. They've got up to 37th. Supposed to be the most powerful country in the world, and you're 37th in terms of looking after your sick. That's barbaric. You're behind Costa Rica. Seriously. Seriously, I'm not kidding. Costa Rica has a better healthcare system than America. It's some little faraway place that some occasionally you go to for a holiday, if you're like adventurous or something. I mean, it's one of the little nobody knows much about it. It's like they have coffee or something. I mean, seriously, sort yourselves out, guys. You're a long way behind. Your healthcare system. Argue for it all you like, but it is crap. On the world stage, your healthcare system is shit. Okay, I mean, I won't even go to America myself personally until you've sorted out your healthcare. In case I get injured whilst I'm over there, it's that bad. And there are Americans who will marry Canadians just to get healthcare. That in any other country they would be called a refugee. You have healthcare refugees in America leaving your country to get healthcare. That at the world's most powerful nation shouldn't have refugees trying to escape the system. That's awful. What are you doing? And the way I liken it to is think of it like this, okay? If you were walking down the street and somebody was riding a bicycle and got hit by a car, it's the car driver's fault, but the cyclist is injured. Do you laugh at that person and say, ha ha, that'll teach you, and walk on? Or do you help that person out and call them an ambulance? Well, I suggest that most Americans would call an ambulance. I suggest most people would. It's the humane thing to do. When somebody's hurt, you help them out. You pull together. That is the essence of social healthcare. That's the ethics of it. And by having this insurance system based on the whole generation of revenue and profit, you're not doing that. You're saying, ha ha, that'll teach you. That's ethically wrong. It's barbaric. And seriously, the worst thing about America, when I look at America as a country, is your healthcare, the way you treat your sick. It's the one thing that, for me personally, stops me looking at America and saying, yep, not a bad country. You're not a good country. You treat your sick diabolically. You are a shame to the human race for what you do to your sick. And that's my position on social healthcare. Um, and I'm uploading this so that the next time I'm asked, which will probably be tonight or tomorrow, I can just point to this video and have my view expressed. So yeah, that's my opinion. Thank you for watching. I'm Becky Rose. Bye bye.